CV bukan main, bro.
Vacation.
Macam, wah, ni mamak ni. Macam mana aku nak baca? Tapi I'm gonna touch a bit of, yeah.
Just say, don't have to talk about my, dentist, educational field.
Tak apa, I akan cakap because this is a man of many hats.
Up to you, boy.
Shall we start?
Yes.
Okay. Hi guys, good morning. We're back again with another episode. Today we have Dr. Vinesh Raj here.
Hello.
He's a good friend of mine.
Yes.
And we actually met through a mutual friend, right? And he's kind enough to spare us some time today for an hour, hopefully, to talk a little bit about his field, where he's an expert in, which is dentistry. So my name is Nicolette, for those who just followed this channel, and I'm the creator for the podcast titled You're Worthless, Read That Again, Juxtaposition of Your Very Soul. Maybe we... Yes. Yeah, before we start off...
Can anyone see? Yeah.
Yes, before we start off, as you guys know, we have some merch coming up soon.
Same color.
Yes, we have a cushion here, and we have mugs as well. We have t-shirt and sweater coming up, so stay tuned. And let me hold it. Yeah, okay. And yeah, as in any part of my ritual, we will start off with an introduction of my guests. So today we have Dr. Vinesh Raj here. Wow. Okay.
V lah. Call me V easy.
V. Okay. So, okay, let me just read out his qualification because that's 3 pages long. But I'm going to keep it brief and let him do most of the talking afterwards. So, V here, he's got a Bachelor of Dental Surgery from the Oxford Dental College in Bangalore, India. And he went on to pursue and acquire a certificate in single implantology course the same year as well. And then I'm gonna skip because he's got a fellowship and membership association in, and he's got an MBA from Lincoln University. That's 3 years ago, 2020. And
Yes.
sorry, we're in 2024. So and he is currently pursuing doctor in oral maxillofacial pathology and oral medicine in our home ground, UM. Yeah. So just let's shine a spotlight on him. He's a man that has received a couple of awards. Jamil Rais Fellow 2019 by Rotary Malaysia. Paul Harris Fellowship by Rotary International, and Successful People of Malaysia 2021 by British Publication House. Wow, when I received this, I was shocked myself. So I got another overachiever here. Like most of my guests.
No, not exactly overachieve. It's more of like there are certain things that you have to do, and if you do good at it, eventually it will come by itself. So
would you say that okay, we're now jumping into the question. Do you love what you're doing?
Oh yes, always I love what I do.
Mm-hmm.
That's the thing I always tell to people, that it's not about money. If you like what you do, eventually it will make the money for you.
Right. Money will come alongside.
Yeah.
It's a byproduct.
Yeah.
We should put it. Wow. Okay. So let's get down to the question. Oh, okay. I didn't know that.
Really?
Yeah. When you do that, it gives you a thumbs up.
No, I think someone did give a thumbs up. So
it's not live. It's pre-recorded, but I think it's a feature when you put like this. It goes like, yeah. I just found out about it too. Okay. So V, walk us through, what was it like growing up as yourself?
Growing up by myself.
Yeah.
As myself. Okay. I'm from KL, but doesn't mean KL. Talking about 34 years ago. it was still not a city yet. We had a lot of places which is like a kampong. So I come from a kampong area.
For our listeners that are outside of Malaysia, kampung is regarded
Village.
as village seems to be very
It's a village. It's a village. So
province
yeah,
upskit like
yeah. So we call it kampong, or you can Google it as village.
right.
So it's from KL itself, and then slowly it got upgraded. Now we call it as Mont Kiara, like so-called.
Yeah, right. Actually, it's in one of the affluent areas
Yeah,
in KL.
So coming from that kind of place, 33 years ago, it was quite fun. You know, you don't have much of stress. You have fun with your friends, and at the same time, you always want to. Since you are there, you've seen things are changing. You want to, you know, improve yourself, get to the next stage. You know, like how long are we going to be at this level? How do we go to this
Next
level?
level.
And that was always that since childhood.
Hmm.
That's there. But at the same time,
Was it instilled by your parents, or you had that innate drive within you?
no. My parents was, I mean, they always focus on like, you know, education is important, obviously, but
Right.
no, it's more of like because the surrounding was changing. Like I said, you're coming from an area like Malaysia was developing in KL, so the area was developing slowly. You can see like from how it was like very like suburban space and becoming more of like urbanizations happening. So you have to keep it up. So
Right.
you have to forego with it and keep it up with it. I think in a way we are lucky that we come in a generation of like we've seen the old generation and the new generation as well. So it's quite good for us to transit with it. It seemed like phone, you know.
Yeah.
When did the first handphone came? Example, I'm thinking it came when I was uh, 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 12, 12,
Yeah,
around
12,
12.
yeah.
And before that, they had the big ass handphone, you know,
Yeah.
the whole thing. That came when I was like 9. Okay. So after that,
My dad never had that.
yeah, and my dad's never had that.
With the briefcase, right?
Yeah,
And I was like, yeah.
After 2, 3 years, it become like slightly smaller and it has an antenna. When you want to talk, you flip it up, antenna. There's only one line. You can't even send messages. And then I was like, when I was like 13, 14, this Nokia came, 3310. And
The soap bar phone.
yeah, along the way from black and white, colored, and then came colored phone. Uh, then came like all this nice flip colored phone, and then it became this smartphone, whatever we're using now. So as how the technology evolved, that's how our generation was able to evolve as well. So it's a similar phase. Yeah, that's what I would say.
Right.
But growing up was fun. It was fun. Always there's up and downs, obviously, you know.
Hmm.
So I had a good group of people around me, friends and all that. So that's important.
Right. Thank you. So let's talk about dentistry for a bit before we get about your life and reflection. So why dentistry?
Why dentistry? That's a good question. Everyone asks me why dentistry. Then I ask them back, why not dentistry? Why not
That's
dentistry?
the same answer I hear when I meet you.
Why not dentistry? I mean, okay, basically, again, coming back to Malaysia, it's all back to Malaysia. Okay, basically, Malaysia never had water fluoridation. Basically, water fluoridation in Malaysia started in the 80s or 90s. So we are in that 80s, 90s maybe. So when the water fluoridation started,
Water fluoridation,
yeah,
or meaning
the
the
fluoride.
the fluoride
Yeah, I was putting
gets
it.
okay.
So what happened was certain areas there were excess fluoride, right? So what happened is the children growing there had fluorosis. Okay, it's a condition where your teeth is kind of like white, but it has yellow spots. So I have it. I think you can see, but yeah. So, but yeah, so since small, I used to go to the dentist in small just to get it checked. So they're like, oh, how does it fluorosis comes and all that. So always have been there since small. So I'm like, okay, dentistry seems kind of like the exposure since I was small. So seems nice as well. Why not venture into dentistry?
Right.
Always had a few other options as well in my head, like you know, becoming a teacher. That's one of the
Really?
things. Yeah, I always wanted to be a teacher, but
Yeah,
I
but
did achieve that.
he's doing it right now. Yeah, I have to be honest.
I did dentistry, did few other degrees, and then I went into lecturing. So now I am teaching dentistry.
Wow.
So
He's
you still
giving
can
back.
do you still can do what you like. Yeah.
That's true. That's true. Okay, I love that. So we have listeners here that are probably across all group of ages. So what are your advice to them on how often should they get the dental checkup?
Oh, dental checkup should be done 6 monthly once. So in a year twice. But the best way for me, I would say, I have a different concept. At least once a year. When it's your birthday. So when it's your birthday, you
It's
get to go see a dentist. Yeah,
self-pampering time. You get
yeah,
everything done. You go to a massage, you
yeah,
go
yeah. True.
manicure, you go, but you don't forget your teeth though.
But you have something called as oral spa.
There is.
Yeah, we call it oral spa. You just go
Wow.
for dentist, get it checked, do a scaling, polishing, get your
Oh my god.
what else you do?
Spa.
Do your whitening. We call it like oral spa.
I love that
concept.
word
Yeah, yeah.
spa.
So oral spa is more how to say human friendly. You know, you
Mm.
say, oh, I'm going to dentist, and then they say, I'm going to give you injection.
Yeah.
I'm gonna wash your teeth with the ultrasonic scaler, and you go, oh my god, it's so scary. So
Yeah.
let's go to a nicer term, oral spa.
Oral spa.
See, when I say, hey, come on, go for oral
Yeah.
spa, you
Oh
go,
no.
wow,
Wow.
so
Yeah.
sexy.
Like okay, spa,
Yeah.
oral, not bad.
Yeah,
Let's go. Okay. So later, I'm going to give you a slot where you can talk about the oral spa and how much the price will cost, and also where can they do this.
All right, sure.
Yeah.
Okay.
Right. So how can one improve the whiteness of your
Improve whiteness of the teeth. Okay, this is a
natural? Yeah,
okay,
yeah,
this is a misconception. A lot of people have it.
yeah.
Baby, excuse me. Baby tooth supposed to be white. That's why they call it milk tooth.
Oh.
Right. That's the reason for it because the milk has a
Gigi susu.
yes. So milk has a reflection index, like all the lights it reflects. So the milk reflection and the baby tooth reflection is the same.
Mm.
That's why they call it as milk tooth.
Oh.
It's not just simply they put the term because of that.
Right.
So that's why it's white. But adult tooth supposed to be slightly yellow tinged.
Mm.
It's not supposed to be white. If your adult tooth is white, something
is wrong
somewhere. Yeah, that means your bone is something wrong as well. So like I said,
Oh.
my teeth looks a bit white because I have fluorosis. Thumbs up. That's always thumbs up. Okay. But anyway, yeah. So, but if you want to maintain your tooth clean, obviously brush twice daily. Don't forget your flossing. Don't forget your mouthwash, and try to avoid chewy food, too sweet. I'm not telling don't eat it. Try to avoid it. Okay.
Mm.
And go for your regular scaling, polishing 6 monthly once a year. And if you want your tooth to be white, just go once a year for your dental whitening, and that should be good to go. There are a lot of other options. People say, "Can I do veneers?" I mean, yes, but
what's Veneers like? I've
veneer-
heard that term being thrown around,
All right.
but I myself do not
Okay.
understand that.
Basically, veneers are like lamination. You laminate your paper. It's the same thing. You laminate your tooth. But what
Whole
happens?
thing.
Yeah. The smile. When you smile, you can see the sixth tooth. They normally laminate whatever you can see. So, but veneers are normally like they will tend to remove certain layers of your tooth to do that. Like this.
Like you're gonna polish and then
more than polish, they'll remove it. Abrasion.
right
They
abrasion.
remove a bit of the tooth, and then they'll have this nice. Take a mold, and the lab they have this nice white shell like laminate, and then they paste it. So lamination or veneers, they're good, but I don't recommend because they do damage your teeth. I mean, I'm not telling you can't do
In
it.
the
You
long
can
run.
do, yeah. But people for us, like normal people, I think whitening is good enough for looking white, and veneers are more for like if your career needs that. For example, you're an artist.
You're front facing all the time.
Yeah, you're an artist. You're a
Maybe I should share.
yeah. So these kind of people they do that. That's why you see all the artists when they smile, nice white too. They were not most, all of them has been. So that's different. I mean, they're doing it due to their career. But for us, for normal, I don't exactly. I'm not telling you can't do, you can do, but let's keep it as natural as possible.
Oh yeah.
No matter what.
Natural is
No
always
matter what God gives, we can replicate.
Keep it. Just maintain it.
Yes.
Yeah. Again, it's like somebody is like right. Okay. So we follow each other on social media. So he is one person that always share all these memes about the downside of becoming a dentist. So share with us, what are the negative aspects of being a dentist?
Okay. So
Not to discourage people.
Okay. I don't only not only I do share about memes, funny memes on the part of that. I do share about dental education as well in my social media.
And also, actually, I think, yeah, I wouldn't say it's the negative, because every job has its
Yeah, ups
own
and downs.
yeah, cons. So, but I think it's good to give people a better light on the good and the bad, and I'm sure it's pretty rewarding.
Yeah. So,
Yeah.
dentistry, what is, let's say, what human, we like, what is bad before you go to good, right?
Yes.
So, what is bad about dentistry? Number one is, you have to study for very long. You have to do your 1 year of
Really?
your, yeah, you have to do your 1 year, like after your high school or whatever, you have to study for 1 year, excuse me, like pre-medical or pre-dental for 1 year. And then you have to get placement in the university, study for 5 years, already 6 years there. And then after finishing, you have to register in the local dental council, whichever country, the same process.
It's like a bar, like a
Exactly.
lawyer.
And then after that, you wait for another 6 months to get registered, get your placement, and then you have to go for 1 to 2 years of training. So along that itself, you already like how many? 5 plus 1, 8 waiting time, almost 9 years done. So by the time you come out, you start working, you'll be like, if you are lucky, maybe 25, but more time 26. I've seen my friend also 27, depends. And even after that, like I said, you have to do your housemanship, your training, and then you still have to fork out a lot of money to go for like professional certification courses like implant, endodontic, few other things. I'm not talking about specialized level yet. So that's take another two,
Not
three
even
years.
specialized.
Yeah, not yet specialized. Now that take another 2, 3 years. So by the time you are considered as a decent dentist, a good dentist who can do a lot of things, you'll be at 30, 32. Yeah, so then when you're going to start your life. And if you're like me, pursuing to be a specialist, you have to take other professional papers, exams prior to that. And then maybe age of 30, 30, 32, you can do your specialized training. And specialist training will be another 4 years. And by the time you finish your specialist training, you come out, you'll be especially age of 38. So, I mean, it's rewarding. It is rewarding, both financially and all that. But you have to be really patient. And it's same for all healthcare sectors. But I think it's good. So that is about the downside. Other downside is, yeah, obviously, is the patient care because we are dealing with patients, we're dealing with humans. So it's more of like when I see you, when I touch you, it's like you're under my care. So I have to be really careful of the medical legal things, make sure I do proper dentistry,
Yeah.
proper healthcare services, so that you are happy, I'm happy, no other issues.
That's true, because there were stories before. I remember a few years back, um, people died because they simply published themselves as registered, so-called, but they're fake, and they perform like a surgery,
Oh
and
yeah,
that
yeah.
person died.
Yeah,
So
we
it's
have we okay. Yeah, in that we do have something called a fake dentistry. So what these people do is because social media. I mean, it's good. Okay, there's a lot of things you can learn through online.
right.
Even if you go now, you guys press now how to do a dental filling in YouTube. They will give a 1 hour video teaching you how to do all of that. So people do learn that, purchase the thing in online because now you have a lot of online platform to purchase things for cheap. All these things they buy it and then they catch some people. They say, "Oh, you go to cleaning, we charge you like
This is
few hundred
so
bucks."
much.
Yeah. So if you do with me, I give half the price. So a lot of people do fall for that scam. It's because fake dentistry is a big thing. So try to avoid that. Always go to a registered dentist in a clinic.
Yeah.
Anywhere in the country, go to a registered clinic, and even if you go to a registered clinic, check who's the dentist, check the name,
Check the
check the name.
qualification.
Actually, you can actually
We can.
every country has their council,
Right.
dental council. Just put there the name. Does it come as registered dentist or not?
I don't know that. I mean, accountants, we have that too. So the same goes for licensed profession like
Yes,
yourself.
exactly.
Thank you. So that's recap. Long journey, arduous, money. So okay, maybe talk about money a little bit because we don't want to get people discouraged.
All right.
Are they avenues for scholarship, or
Okay,
must it be
Okay, depends on
own
the
money?
country you come from. I'm pretty sure every country have their own scholarship, but not as much. So you still have to like figure out somewhere how to get. If you are coming from financially well-doing family, good and well,
Mm.
you have the financial support. But if you're coming family like me, like middle class family, so it's impossible to come up with that much money.
Yeah.
So you have to work a bit hard for your studies, so you get the scholarship. And but nowadays I think they do have the student loans, etc.
Grants and
Yeah, yeah.
whatnot.
So you can go through that as well, or you can work for some years and get some money, go into it. It's doable. There's always a way.
There's always a way.
There's
Yeah.
always a way.
That's what
There's
I
always a way. There's always a way. Yeah, like for me, I still remember the first few years. Whenever this holidays, I will still work in. I was in F&B. I used to work in coffee shop, ice cream shop. I'm not going to tell the brands. So like,
Same. I went.
yeah.
I not cafe, but I work at accessory shop. The places that I love to go. I love to watch movies, so I did work. It was 3 ringgit 50 cents per hour, guys.
Oh, that's so less. I have
I
to pay. I have
You see,
selling
that was
coffee. I
back
have to
in
pay.
that was back in 2010.
Yeah, around that time was. I would think mine was way before that. But I think I had better salary than that.
Yeah, but because I love it so much, I get free tickets. When you're young, you just say, "Okay, I'll do it."
I'll do it.
Yeah.
So that's one of the
Again.
ways. Yeah, again. Yeah. So that's one of the ways for you to make financial to support you a bit. Obviously, study loans are there, etc. So there is a way. There is always a way to do that. And then and then you make sure that you can even get scholarship in between. Like you go to the first year, okay, and you perform very well, and you can use that result even from the uni itself. They say, "Oh, you're a very good student. We can give you 30% or 40% off." There's a lot of places like that, things like that. But you just have to find out what are they. There are a lot of things like that.
Okay, guys, do your research. Because if you love something, now in this case, dentistry or anything in life, do your research. And there's a will, there's a way. Remember that.
True, true.
Okay, so tell us, V, what is one thing about what most people don't know on the correlation of their dental health to the different aspects of their life? For example, confidence,
Okay.
signs of diseases, if there's any.
Okay. So basically, number one, it's a sign of confidence, right? So your smile is part of your aesthetic makeup. So when you smile, you have nice teeth, you feel happy, you feel confident. But when you don't have nice teeth, you tend to lose your confidence. You don't want to talk. You go a bit quiet down. That's normal. That's very normal. So go find a good
It's
dentist.
God given.
Yeah. Good.
Yeah.
Go find your neighborhood dentist, friendly neighborhood dentist. So if you have any your tooth is marked, aligned, move front or back, you want to do braces, go find them. They'll advise you accordingly. Get that done. That's number one. We're talking about confidence, self-confidence, important. Number two, diseases. Yes. Um, you see, everything which the disease happen because of what? From inside.
Internal.
Yeah, from
Yeah.
inside. How do things get inside your body? From your mouth. So whatever you have in your mouth, you get ingested and becomes an issue. So if you have some gums problem, your gum problem, there's a research saying that it can be related to your heart problem because the bacteria can go there. Your stomach problem, yeah. And the same way, whatever you have internally, the first thing comes out, the sign is in your mouth as well. Don't forget some people have smoking habit, etc.
Yeah.
You have your head and neck cancers, etc. and all that.
Also, head and neck.
Yeah, cancers. When you smoke, so
Right.
that field also comes under the
ENT.
dental. We call it maxillofacial head and neck.
Maxillofacial.
Yeah,
Okay.
head
Which
and
is
neck.
what you're
I'm
working
doing
on.
I'm doing maxillofacial pathology. So I see a lot of cases of like even this week, Monday to Friday, I think I reported almost 4 to 5 head and neck cancer cases. I do more the pathology, so they give me the sample. I check under microscope. Oh, it's a cancer. So so it's correlated. And the other disease also correlate, like they said, not they said research has shown that your gums health also correlate with your diabetic level. There's a lot of things, right? So as I said, go find your friendly neighborhood dentist, get it always on check, make sure everything is okay, because it's part of your health. You can't neglect it. So one of the question I always have this question. I have patient coming to me. They have 30. I mean, everyone has 32 tooth in general, right? So if their tooth get damaged, they say, "Oh, doctor, just plug it out," right? And I'm like, no, you can still save it. Then I said, okay, you have 20 fingers. So if you damage your fingers, like you kind of like,
chop it off.
yeah, you like, oh, I hit the door, close the door, it's just a bit chipped off. I mean, like, damaged, like, then you should cut your finger off, right? But you don't do that. So
Yeah.
people don't get that awareness. your tooth is as important as your fingers. Then when I tell like them, like, oh yeah, correct, correct.
Then you give them a revelation and epiphany that okay, this is worth saving. If you cannot save, then
That's okay. Worst case, once you cannot save, you have to remove it. Then you go for replacement like implant, cartridges. But 70% time of time you can save it. Excuse me. And the other problem is I notice with people is like people do buy like example the latest iPhone, what 14 Pro Max, whatever is it.
no, this is 11 Pro Max, guys.
So 14. When I say 14 Pro Max is like one of the quite expensive in the market now, right?
7,000.
Ringgit, yeah,
Yeah,
7,000 ringgit.
ringgit. Yes.
And for you to fix your tooth, an implant nowadays costs you 5,000 ringgit. It's cheaper than 7,000 ringgit. So which is more important? Your iPhone which lasts for 2 years or the implant which can last for
Lifetime.
15, 20 years. So
Yeah.
people awareness.
Prioritize, guys. Prioritize. No, thank you about that. So I think the key here is that I think it's good. I myself am guilty of that. That I put the health of my dental care in hindsight because it's always 20s to 30s. Now that I'm in my 30s, it's always like, okay, get the external things, get that. But now I've learned to appreciate better. I think age is catching up. Therefore, you need to care for what's given to you by God so that you can last for a while.
So you can eat good food even when you're old.
Yeah, you are what you eat. Right, so let's talk a bit about your life, V.
Okay.
What have you learned so far in your career, studies, and in treating patients?
Okay, so talk about my life.
Again, with that. It's like everywhere. I didn't see this last night.
All right. So because of his special.
Oh, maybe, yes.
So about life, okay, so first of all, people must understand that I have a condition called dyslexia.
Well, thank you for being candid and honest.
Yeah, it's a very normal thing. So 30 years, 33 years ago, 30 years ago, I mean, that people with dyslexia is not diagnosed and very minimally diagnosed. And people do not know that. So even I didn't know that, but I always had problem with languages. Language was not my forte. I never liked it. I'm good at science and math, but when it comes to language, I couldn't grasp the spellings. Like all the spelling mistakes. I can't read fast. I don't understand. I have to read one thing like what the heck they're writing there.
But to study dentistry.
Yeah.
Wow.
Yeah,
What a paradox.
yeah. So it
So
makes.
it can be done.
Yeah, it can be done. If I can do it, you guys who are normal can do better. But yeah, normally I say
Oh.
God is great. So when He gives something less, He'll give something extra somewhere.
That's true.
So since I have this issue, so He made me a bit hardworking, so I like to study more. Yeah, not only the smart ones, I noticed my friends who are like gifted smart,
Like,
they are not hardworking.
yeah,
And
they're like, because I have it, so what for?
Yeah.
What
No,
put
no,
more
it's
effort?
not like that. It's because God is great. God make sure that everyone gets everything equally. But how you gonna? So if like you're smart, I'm not gonna make you hardworking. Oh, you have dyslexia. I'm gonna make you very hardworking. So
It can be instilled, you see. It's up to you.
yeah, it's true. But
Everybody has a choice then.
yeah, so that's there. So going through that
Okay.
was not easy.
Mhm.
But yeah, but I got mild dyslexia, not severe dyslexia. So that is another.
Walk us through what's the difference between mild and severe? Because I myself not very sure of that. Like,
So
how would that differentiate?
dyslexia, they have some stages. Mild, basically, the simple thing we put mild, moderate, severe.
Mm.
So mild is where it's something like me. It's like obviously you can't know location left or right.
Right.
It doesn't work. So even when I say left or right, say I was showing the right side first, so it doesn't register. Very slow.
Really?
Yeah, it's very
Do I
slow.
have?
Now some
So-
people think they have it,
Yeah.
but no, mine is like literally that. That's one of it.
Okay.
And then when they read, they can't read fast. They read, they can't understand because like they need to understand each words. There are a lot of pronunciation that I can't pronounce, especially a lot of C, S, H together. I try to avoid the letters. Right, it doesn't come. And then there are a lot of words where I can't pronounce as well. It takes me some time. Sometimes I ask my friend or my wife that, hey, how you pronounce that? Example, like let's say there's one example like contemporary. Yeah. See, so it's like contemporary. It's like I'm happy like my head doesn't come out straight. So I have to ask the people, is it correct way of pronouncing it? So that's there. And then writing, there'll be a lot of spelling mistakes. So yeah, that's mine. Moderate is sorry, slightly worse than that.
Do you have
No, no,
some
no.
tea?
Moderate is a bit more worse, but the worst is the severe part is a bit sad because that is where you have all the P and B, everything is
Oh.
mismatched and all that. It doesn't register. It's like it's more of like how you guys see these Russian writings,
Mm-hmm.
like
Yeah, like
that
that.
all the PA all
Yeah.
upside down. So normally the severe dyslexia, they'll be writing normal English like that. So yeah, that's there. But that is not mean we are dumb. It's just that our certain processing part is like a bit slow or not aligned properly, but we are perfectly normal.
Yeah. Yeah.
Yeah, yeah.
Well, thank you for that. Yeah, so coming back to what have you learned in your career and studies and
Learn
in
in
patients?
career. Obviously, you have to be hardworking. You have to be really patient.
Mm,
Dedication, obviously, and you have to like what you do. If you force yourself to go into it, it won't be fun because trust me, you won't do this until your whole life.
mm.
So if you walk in every day to your dental clinic or the dental office and you don't like it,
The dreadful feeling.
yeah,
Yeah.
so that's not the place. So that's why I like teaching. I like dentistry. I like teaching and doing research, but I prefer research and and teaching more. So I went into the more of the research part, teaching. That's why I became a dental lecturer. So do what you like. I always say practicing clinical dentistry earns more money. But like I said, it's not about money. It's about how happy you are. Money
That's
eventually comes. Money eventually comes.
exactly.
Yeah, money eventually comes. It's there.
Like to resonate, internalize that because I myself believe that. I mean, in 20 to 30s, I've done um, chasing things, getting somewhere. So I think it's high time for me to come back to okay, what really gets me going, you know? Yeah, and it's all right to make that move at any stage of your life. I think
Yep.
it's very important.
Yeah. I mean, like financial stability is important. So
Yeah,
achieve that, obviously. But achieve that by doing what you like.
you,
I'm not, when I say financial stability, don't get me wrong. I'm not talking about I want to become multimillionaire. No, no, no. You can just become someone with normal, average, whatever, but
yeah,
you're stable financially.
yeah,
That means you can afford whatever you like. There's a roof on top of your head. You have a car.
yeah.
Doesn't mean the car have to be BMW. Okay, it can just be a
True,
Toyota.
true.
And at least I drive a Toyota, the most basic Toyota. Imagine that.
I love you.
Yeah. So some people, most of my friends who are in the clinical and really driving BMs, it still gets me from A to B, no
Yeah,
issues.
yeah, yeah.
But it's always like what you like because like I do notice that my friends like, oh my god, I have so many patients, I'm so tired. I'm like, you get extra, but you have
You're
that every
tired
day
every day.
and you're
That's right.
complaining and you're going to have to do that for my life is like I'm chill. I work Monday to Fridays. I do some research. I go do some teaching. I do some study club. I do some pauses, and I'm like happy. Like meet new people, young dentists, old dentists, talk to them. You know,
You can
and
see, you can
yeah,
feel the vibe, right,
yeah,
guys? He
yeah.
is vibrating
So
a very positive glow.
yeah, so thank
So
you. I don't have any skin. I don't put
this,
anything. I'm a guy. I don't put
this is
anything. But
this is what you see is what you get.
yeah, yeah.
Right. So okay, I think this will back up to whatever that we have just said. What are your motivating factors?
So my motivating factors. Always you have to achieve. You have to put some goals.
Mm.
So whatever you choose, pathway you choose, you should have a goal. Your short-term goal, moderate goal, and long-term goal. So you have to put it and keep on taking to achieve that. But make sure it's realistic. Example, like don't say, "Oh my God, I always dream of having a Lamborghini." I mean, like, oh, can be done, but a bit difficult. But while we put a bit more realistic dream, okay, I like to get a BMW 3 Series. Example, okay, not promoting BMW, just putting there.
This is not a paid promotion,
Yeah.
guys. But
So
if BMW would love to
yeah,
promote this show, please,
yeah. Please go
we
ahead.
can take it offline.
So yeah, so just put a tick there, okay. And also in your career, whatever you do, example like you can even sell candles, homemade candles, right?
Oh yeah.
But you put that target. Okay, this year I'm gonna next 2 years I'm gonna conquer the local community. 3 to 5 years I'm going to spread around the area. 5 to 10 years, maybe I'm going to have my own company, small company, production house where I have two, three people working with me, maybe go even bigger. So it's your passion becoming achieving. So you don't have that to have motivation. You can't just go, like, oh, I like to do candle. You can't be motivated with that forever. You might understand that.
Yeah.
So write down, take a piece of paper, write down what you want. Like I say to all my students, take a piece of paper, write down what you want in your life, A to Z.
You're so left-hand.
Huh?
Are you a left hand?
No, I'm a right
Okay.
hander, but
Okay.
I can use my left hand as well.
Okay.
I do can use my left hand as well. So you just write down, like, like on a piece of paper, like what I want in my life, how I'm going to achieve that. Short term, long term, what, and then whatever then you feel like it's a bit too far fetched or not realistic, try to sketch it off. Try to bring it to your mentors. Normally, my student will bring it to me, and I said, "Okay, we can do this. We can just." Sometimes they need advice, possible to do or not. Even I have my goals. Where I ask my senior lecturers, like, okay, one of my aim is that I'm in lecturing field. Obviously, you have to aim to become a professor. So I asked my professor, like, how do I do that to become a full prof? So I have this. Can you like tell me which I should do, which I should not do?
What are the gaps
Yeah.
you need to close, right?
Yeah. So do all that in any field. Yeah, should be there.
Thank you. So, what are your views about the younger generation right now in terms of their academic and the things that they're pursuing?
Okay. Um, Younger generations, they're actually quite technology savvy.
Yeah.
Uh,
Yeah.
so basically, even dentistry, everything is going into technologizing because we have 3D scanners, 3D printers. It's very good. So in that way, it's quite good, but you still need to know the science behind it. And the younger generation have more advantages because, like I said, when I studied my anatomy, I have to look at a 2D book. 2D, black and white, sometimes like very basic colored
And
book.
the skeleton.
Yeah, right. On that, I'm like, oh my god, you don't even understand how the nerve goes. And then after reading that, you'll have like a body there, like like
Whatever.
cadaver there, and they have to cut it off. Even when you cut it off, there's no color; it's all brown.
Yeah.
It's all brown. So you don't know where's the nerve, where's the blood vessel, and how you can't figure. But the new generation, you can open YouTube or any education center. They have this 3D model and access to everyone. You can, oh, this is how it go 3D. This is how it go. I'm like, oh wow, I'm quite impressed. So in that way, it's good for them. But don't forget your obviously your textbooks and research. Yeah, that's more important as well. Other than that, scientific evidence based, anything, let's say evidence healthcare, right? Go by evidence based. If they do based on what they like to think, I think it's like that. No, no, no. Please go by evidence based.
Do your research.
Yeah,
Do it properly. Do it the
I
right
think
way.
the younger generation they have more opportunity, and I think the like as we are becoming seniors now, we are much more how to say tempered down compared to my lecturers who were my teachers. They were more strict. I still remember they like even if you're like 5 minutes late, they're like, oh, you're late. It's 8:05. You're supposed to be here by 7:50 before I come in. They're like, get up, close the door. So but nowadays we don't do that. So
Yeah.
yeah. So in that way, yes. In that way, the younger generation, I think they need to improve a bit on their EQ a bit. They have good IQ, but I do feel that EQ need to be a bit on par. I don't blame them to the generation like this,
Yeah.
but for healthcare sector, oh, excuse me, you do need a bit of discipline, a bit of EQ, so things goes well.
Thank you. So, what is next for you?
Next for me, so currently doing my doctorate program, and after finishing it, I'll go back to work, focus a bit on my career, getting my associate prof and etc. And after that, obviously I have to go
Fantastic.
and
Associate
study,
Prof. Dr. Vinesh Raj.
yeah.
Wow.
Oh,
What
still long way, but that's
what
a
a
goal. That's a goal.
how long will that take to
Five,
obtain it?
five, 5 to 7 years maybe. And after that, maybe go for my another doctorate, most probably another sector. Because I'm in education field, so
You see, guys?
you have to do that. Education field, you have to like to what you do. So
Yeah. So yeah, this another doctorate is
it will be more on like PhD on research. So maybe it will be more on the pathology side.
so you're complementing your oral maxillofacial with
Yeah.
the research.
Yeah. So if you're in education field, that's more of like a must. So do it. Yeah, you have to do it.
How inspiring, guys.
Yeah.
So the key here, love what you do what you love.
Yep.
Right. So we're going to pivot to a self worth question
Can,
because that is the essence of my podcast.
can.
So, in your life, V, have you ever succumbed to the feelings of worthlessness? And if you did, how did you overcome?
Always everyone at one point of their life, they do go through that, you know, maybe due to external factors like other human, friends, relationship, your studies, your career, your bosses, whoever they are.
Yeah.
Um, but the one thing I always tell to myself that, you know, when I was in that situation, like, I can do better. You always can do better than what you're doing now. So if you're in a relationship, it didn't go well, you can do better. We all have been there. You know, and you've been a better life, better job, you're not in workplace, you think it's not good, they don't treat you right, toxic, just leave it. You can do better, you can get a better job, better place. Or you start your own thing and you become your own boss. You can always do better. Talking about education, same thing. If you feel like you can't do well, just take some step backs, go back to the basics, improve on the basics of your education, and you can do better. So always remember, think, uh, always remember you can always do better. Take one step back and always think, is it worth your time to fight or be there? Whether it's relationship or even company you're working. If the company is not good, like the corporate company you're working is not good, not worth it, it's okay. Say tata bye bye. There's a lot of other companies out there. Maybe a bit lesser salary, but you'll be happy and slowly you'll build up back your portfolios and something will open up. Learn some new skills. Same thing in relationship. If you feel it's too toxic, you don't like it, don't think so, take a step back, try to discuss with them. Doesn't work out, fortunately, unfortunately, not meant for you.
Yeah,
Then that means there's something, someone else there for you better. That's all.
that's true.
Same thing for education. Doesn't work for you. Take a step back, go back to the basics, strengthen it back, and then go back again. So it's okay. It's okay to go a bit slow. Take a step back. Yeah. That's how I always think of. It's that's like, you know, when I'm in that situation, I always say I can do better. I'll take a step back and either we improve our basics or take a step back, take another path. That's the
Mm,
that's the way you want to do it.
thank you, V. What is your heart's greatest wish?
My greatest wish
Mm.
for myself or for everyone in general.
General, for yourself also. Yeah.
For general, it's very simple. I mean, I just hope that everyone can help each other out, so we don't get what's happening around the world nowadays. You know, not only Palestine, any other countries. You know, it's unnecessary.
Mm.
And we're talking about the riches. I think a world given by God.
Yeah,
So,
everybody should have a piece of the cake.
yeah, so I don't
Yeah.
understand why we have people who don't even have food to eat,
Yeah.
and at another part of the world, you have people who have too much food to eat
Too
until they
abundant
throw
with
away the
yeah.
money
Yes.
on food. So it should not happen. So I feel that's one of my wish. If you know everything can be, how to say, equalized, you
Mm.
know, so that everyone is happy. You know, the world is enough. Trust me, the world is more than enough. My personal wish, obviously, I want to do what I like, help as much as people I like. I like to help people. That's why I'm in Rotary Club. Help people as much you like. Take life simple, not too much headache. Yeah, thumbs up. Take life simple. Take
Yep.
life simple. Do what you like. Obviously, financial stability is important. No, thank God reaching there, and just keep on doing what you like. And like I said, don't do bad to people. If you can't do good, it's okay, but don't do bad to people.
Mm.
And if you can't do anything for people, best thing, don't do anything. Just do good for yourself. In that way, you don't harm other people, but you help yourself.
Yeah. And be a better contributor to the society.
Yeah, give back to the community. That's important. That's important.
Do you have a mantra that you live by?
My mantra, basically, my mantra is very simple. Just like I said, in whatever you are doing, I mean, do what you like. Number one,
Mm.
all right. Always do what you like. Pursue what you like, and try your best to do your best in what you like. Don't compete with others. Never compete with others. Your own competition is you, is yourself. Like let's say, like same thing for example, like for studies. Let's say your science paper. Oh, this time you set for your exam, you got 70%, and you see all your other friends are getting 80, 90s. It's okay. It's good for them. Don't worry about that. You focus on yourself. So the next exam, you get 71. You get one extra. That's achievement. So you try to, okay, next time, do 72, 73. Eventually, by the time you notice, right, when you look back, you'll be the best there. The same thing for your financial as well. You say, okay, this year, my salary is, I'm earning like 3,000. It's okay. You can say, my friend are earning 7, 8,000, it's fine. Next year, I'm going to put 3, 5 average. And you're going to find out a way how to make the extra. So slowly increase 200, 300, 200, 300. So by the time you look back at 10 years, after 10 years, when you look back, oh, you're already earning 15,000. And you say, oh, my friend who used to earn 7,000, only at 10,000, I'm already earning. Yeah. So that's one thing I said. That's, yourself is your own competition. You don't need other people. Yeah. That's
Thank you
important.
for that reminder. So, do you have anything that keeps you up at night, or do you sleep well?
My son keep me awake. I'm only 6 months, so he keeps me awake at night. So that's I just joking, just joking.
Well, I do have my cat that keeps me up at night sometimes.
Um, Basically, no. I try my best to get good sleep. As long as you get good 6, 7 hours sleep is very important. Go to bed peacefully as much as you can get good sleep so that the next morning when you start up your day, you are fresh. Okay, that's if you have any problem, any issues, put a stop, clear your mind 1 hour before sleep, and just go to sleep. When you wake up next morning, you'll have more ideas how to deal with it.
Yeah, not to ruminate over it.
Yeah.
Yeah. Right, we're down to the last question.
Oh, sure.
If you could create a quote right now to leave to the audience listening and the world as your legacy, what would it be?
Oh, put on. I thought of that. Okay.
This is my ritual.
So basically, don't think about a quote that you want. Like, what I would say is again, do what you like, do your best in what you like, and improve yourself to be a better person on a daily basis. That's what I would say.
Wow,
Yeah,
perfect.
that's good. That's good.
Yeah, nothing complicated. Just keep it simple.
Yep.
Love what you do. Do it to the best of the quality, of the best of your ability, and
Yep.
don't focus on others. Focus on yourself.
Yep.
You are your own competition, and who knows, 10, 15 years, you look back, you already
Yep.
achieved so far. And so much. Well, thank you, Vin,
Most welcome. Thank you.
for this wonderful conversation. And thank you
for having me
guys.
here. By Nick, you are worthy.
Yes. Thank
And you are enough.
Yes. So, guys, thank you for staying tuned. If you like this episode, please continue to support us on all our social media. We are on YouTube, Spotify, TikTok, and Instagram. Don't forget to give us 5-star rating in Spotify, and on YouTube, continue to like. You need to like, subscribe. Remember, subscribe.
I know it's down. I think it's down. It's down. It's supposed to be down somewhere like that. Yeah.
Subscribe to our channel and give some comments. Yeah. Right. Thank you guys. See you again in the next
Bye-bye.
episode.